Hi, we are back. So welcome. We were just taking a photo of Kim's very on-brand shoes. So if you notice her at lunchtime, I really encourage you to look down to just understand how on-brand they actually are for the change colours. It's pretty cool. So that's what we were busy doing while we were waiting. Okay, with no further ado, I would like to introduce Dr Joy Parkinson from CSIRO. She has an amazing depth of knowledge around evaluation, and we've talked a little bit across the whole 1.5 days about just the true importance of data and having evidence, because really without that we can't make enough case when it comes to things like asking for funding. So we're really happy to have Joy here with us today, because we all know that what gets measured gets done.
Thank you, Sharyn, for that wonderful introduction. And not a good idea to leave your water way over there right before you start speaking. So, as Sharyn said, I am Joy Parkinson. I'm from CSIRO. Now, full disclosure, I've only been working there for 3 months. I formerly worked with Sharyn and the whole social marketing at Griffith team for the last 9 years at Griffith University. So as Sharyn said, I have a range of knowledge and experience about evaluation and implementation. So I know we've had an incredible lineup of speakers over the last 2 days. We've had Cute with the koalas, and it's so wonderful to see how that work just continues, so important. We've looked at, the 5E framework, knowing when to stop doing things or when to do more of things. We've learned about fish and changing the type of fish that fishermen fish for. We've talked about cars and bikes, and that's a conversation that I truly love. And I'm sorry, I am not as funny as Alan. And then we had some wonderful presentations this morning as well. I hope I don't make you cry, like some of those might have this morning. But how incredible have the presentations been? Just so amazing. Now I'm going to talk to you about implementation. So not quite as sexy as what we've been talking about. But I really want to talk today about closing the gap between what we know, so all the wonderful research we do, and then what we do. So how do we actually get it out there, out of the filing cabinet drawer and out into the real world? So and just a quick acknowledgement of country as well. At CSIRO, for us, it's really important to acknowledge the traditional owners of the land and the waters on which we work, and we pay our respects to elders past and present, and we pay respect to those that we work with, and I pay my respects to those who are here with us today as well. So this is some of the team I work with. This was before I started. So we are part of I'm part of the Australian eHealth Research Centre. We have people who sit all over Australia. The main office is here in Brisbane at the Stars building at the Royal Brisbane Hospital, which is a bit of a change working on a hospital campus. So every day I put my little mask on to go into work. We take them off in the office. But these are truly the brains trust. There's some incredible minds. They're doing some amazing work that's making a huge difference in our hospital and health systems right across Australia. Our group also does some work into Chile, so we don't just work here in Australia, but some amazing work that we're doing. So these are just some of the amazing people that I work with, and I submitted these slides last week, and since those slides we have now won a 2022 Brilliant Women Award as well. So very cool to actually work with these people who are doing incredible work. We have a range of technologies that we work on. We have the Mother app that's helping pregnant women manage their gestational diabetes, so remote monitoring so that they don't have to go into the hospital or to their GP all the time. So, coming back to that nice social marketing perspective, really making it accessible for them and reducing, the impacts. We have and some of those great minds that I showed you a photo of before have been working on an algorithm that helps predict patient deterioration for people in hospital. And that has just been piloted here in Brisbane, just down the road at the PA hospital, and it's working really well. So we're just about to start rolling that out into a more or beyond pilot testing, starting to actually test it at the QE2 campus. So doing some truly amazing work. But all of that amazing work also needs to be implemented. We need to scale it up. So for those of you who've heard me present before, you know that I say you can have the best program, project, innovation, service in the world. If no one knows about it, or if nobody uses it, what's the point? So I've worked on a whole bunch of different evaluations in my time at Griffith. I worked for about 5 years on the My Health for Life program. I know one of our colleagues from Health and Wellbeing Queensland is here today, who are the funders of that work. It's doing amazing work. But doing the evaluation of that has really helped to feed back into the implementers to understand what works and what doesn't work, so they can do more of the things that are working well and start to change those things or address those barriers when things aren't working quite so well. And that program is achieving huge success. And if you've seen me present on that before, you know that it's achieving behaviour change across all of the target behaviours, and people are losing weight, reducing their risk of developing chronic disease as well, so really important. Done a lot of work with the Stroke Foundation as well on implementation of their Living Well After Stroke program. So again, really important as people come out of hospital and go back into their homes to manage their own health and reduce their risk of having another stroke. These are some of the projects I'm working on now with CSIRO. So we are working with Northern Health, for example, and an organisation called Rowland, who develop technology as well for in-hospital. So this project is about reducing falls in hospitals, because I didn't know this, but falls are really common in a range, for example, people who've had a stroke in hospital. And so helping the nurses to be able to manage that and help them work with their patients to prevent those falls happening is what we're working on here. And that's through using a smartphone, so that they get messages from the patients to say they need help to get out of bed to go to the toilet, or whatever it is that they need help with. So it's actually helping prevent the falls. But again, we are just working on the implementation of that at the moment from Maitland Hospital in New South Wales before we start to roll it out in Northern, which is in Victoria. But some of the barriers that we've already started to identify there is that there wasn't enough consultation with the nurses who actually use this. So, we've talked a lot over the last couple of days about really understanding who our target audience is, or our customer, or whatever you like to call them. And for us at CSIRO, our customers are people, the earth, and the water. So I'm really proud that I work with an organisation who treats all of those equally as their customers. So that's who we are working for. But an interesting conversation I had with some of my colleagues in about my first week at CSIRO, when we were talking about another program, or an algorithm, a workflow algorithm for emergency departments in hospitals. And they were talking about taking a people-centred approach. And then I said, so have you talked, they were having trouble engaging with the clinicians. I said, have you talked to any of the clinicians to ask them, did they want this or how it might work for them? And they said, no. I said, but you're talking about taking a people-centred approach. Have you talked to them? They went, no, but they're clinicians. I said, still people. Still people. They have a heart and a brain. They're still people. And you could see in the room a light bulb go off. So these are some of the things as an implementer or an implementation scientist that we are still working on, and we will continue to work on. And I'm sure you all have examples of that in whatever it is that you do, where people just forget that doesn't matter. People in the system are still people, and they're the people we need to engage with to get them on board to take up whatever it is we're trying to get them to do. So, yeah, interesting, and I know I'll have a job for a very long time, as we all will. Health Direct is another organisation we're doing some work on evaluation and implementation of the Living with COVID service, which is a website and a messaging service to GPs and an outbound call centre as well. And that's for people who actually have COVID. And that's had really good feedback from the people, I don't like to call them patients, the people who've had COVID, with how that's actually helped them. And in New South Wales, part of that service was then to connect people who were who were more at risk, to connect them with getting antivirals when they received a positive COVID test. So some really amazing stuff that we work on, and every day my mind is blowing, it really is blowing, at CSIRO. Just amazing, and so good to be working somewhere that is working on so many impactful things, and it's such an important part of who they are, and it's central to their DNA. Another project I've been working on as I've kind of transitioned across is the Oz Harvest Nourish program. And at Social Marketing at Griffith, reducing food waste is a really important thing for us. It's something, or for us, them, they've been working on for a long time. So it's a real privilege to work with Oz Harvest, but not on food waste reduction. The Nourish program is actually an education program for young people who have lost all hope, and the next step for them is probably death or prison. So they really are those, people that fall through the cracks, or potentially can fall through the cracks. So they have a range of referrers into this program, and what they do is deliver a certificate in kitchen service, or kitchen skills. So they start to learn some of those pre-chef skills, but they're also learning some life skills and building their self-confidence and just the change. It's been amazing. We've interviewed 45 past participants, current participants, their parents and caregivers, the social workers, and their employers as well. And just the stories, it's incredible. Like, some of the work that people are doing out there in the community with these really underserved people is just amazing. But what we've gone in there to do is to look at, what's helping the service and what's stopping it from growing as well. So really starting to unpack that. So that's some of the things I've been working on. Now, that's about as exciting as this presentation is going to get, because now I'm going to delve into implementation. So let's move on. So knowledge translation. There's all these terms that kind of get bandied around all the time. And I'm sure that sometimes we don't really know what that actually means. But knowledge translation is the process that includes the synthesis, the dissemination, the exchange, and ethically, and for me that's a key, sound application of knowledge to improve, in my context, health. So provide more effective health services and products and strengthen the healthcare system. So it's really improving not just the people at the end of the line, but that whole system as well. So really important. But we really need to close the no-do gap. I've had so many conversations over the years about great research projects that we, think about here in Australia, ARC, NH and MRC, how much funding has been poured into research. Where is that research now? So much of that is sitting in a filing cabinet drawer. It might have been published in a journal, might get 1 million citations, but has it helped anybody? Possibly not. And we know from the medical research that it takes about 17 years. When I first saw this in a Monash ad, I thought, that cannot be true. I've worked at Social Marketing at Griffith. We did not take that long. We were getting stuff out there much faster than that. But we didn't do RCTs either. but it's taking 17 years, and this hasn't improved much. I know this is from 2011 paper, but hasn't improved much. So we have to do something about that, and and start to close that chasm of, the knowledge and that research, which is so important, and actually getting it into practice. Who's had that difficulty of having done a great project or a little pilot study that was fantastic, but then you couldn't get any more funding? Anybody? Yeah, I think we all have. So implementation science, it's a scientific study of the methods that helps us to develop or increase the uptake of research findings and other evidence. So when we talk about evidence-based or evidence-informed, I like evidence-informed because I think we're always learning something new. So we never take it exactly what it was before. We're learning from different places. And we embed that into routine practice and then improve the quality and effectiveness of the services that we deliver. And as I said, my background is, I work in health. This can apply to anything that we do, whether that's, environmental or any other social issues as well. So why do we need to focus on implementation? So we want to know, does it work? That's where the evaluation comes in. So looking at efficacy and also effectiveness. But does it work in the real world? That's the key. So we want to know, does it work in different contexts? And we know we have to understand what the context is where we're delivering our innovation, our program, or our intervention. And then we really need to understand what are the barriers to uptake and what that might stop it from, being used or adopted by people. But also, what are the facilitators or what's helping it as well so that we can amplify those things? Again, timing is everything. We so often do implementation and evaluation just at the end and do everything retrospectively, but it's really important, and I know sometimes funding is an issue, we need to embed this at the beginning. And when we looked at that youth-led program in Toowoomba yesterday, looking to tackle youth violence, that was a great example of thinking about all of this right from the very beginning and involving all the stakeholders in the process. So, a bit of doom and gloom here. 5 reasons implementations fail. So, lack of clarity in the aim or the innovation, so not really knowing what our program is. A lack of understanding of the context, so not doing our due diligence and our homework. Not including people in the plan or planning. It's kind of sounding familiar. There's a real thread of theme here. Bad planning, so implementation plans should be well designed and guided by a theory of change. We saw that in the Toowoomba example yesterday, how well that actually works. That was just such a great example of how to do implementation well. And then failing to build support for sustainability and scale up. That's the key as well. This is how you get it out of the filing cabinet drawer, is to be thinking about getting people on board, making sure they understand how well this program's working. So dissemination is really important, whether that's in academic journals one way, but really getting it out there in the media, having a dissemination plan is important. So these are some of the, and feel free to take photo of my beautifully developed diagram, that I'm pretty sure that Sandra had a heart attack when my CSIRO slides do something weird, but anyway, we made it work, it looks correct. But it really is an iterative process, and we have to start by listening to people and keep on listening to those people and involving them in the process as well. And then we have that readiness assessment, and we can use different frameworks, which I'll talk a little bit about in a second because I'm speaking too much. I told you I'd have no trouble. So there is loads of frameworks, and I know if you don't work in academia, frameworks are a little bit scary. But implementation guided by some sort of framework will be more successful, and same with evaluations. So there's loads and loads. There's the consolidated a framework for implementation research, the theoretical domains, that's by Susan Mickey, so et al. If you've heard of COM-B, same group. This one I'd never heard of before. Precede, proceed, and then re-aim. But we also have to choose the right frameworks. So for example, if we are rolling out a technology in a hospital setting, we don't use re-aim. It's a public health framework. It's looking at, are we reaching the target audience? When we're rolling something out in a hospital, the target audience is fairly fixed. So we're not aiming to grow our reach there or reach a target audience. We're talking about adoption and those types of things. Then we come up with implementation strategies. And as a marketing person, strategies is not actually the right term. So that's something I'm setting out to change over time. Because strategy is around the roadmap to get to the end point of what you're trying to achieve to create value for somebody or something. These are more like what I would call tactics. So having all of the little things in place when you've identified barriers. And we have the ERIC mapping tool, which is a fairly new tool, but it's the expert recommendations for implementing change. Probably needs a little work too, because we don't always just want to have experts in the room. Sorry, experts. Then we can start to specify, what are our reporting strategies as well. And you can see all of the, probably not as clear on the big screen, but these all have the references there if you want to do some further reading on any of this. So how do we actually map some of our consolidated framework for implementation research constructs onto the barriers and the ERIC strategies that help us to overcome those barriers? So we've got things like adaptability. So, people don't believe that the innovation can actually be tailored to meet local needs. So what do we actually need to overcome that? So that's where we might start to say, actually, yes, we can, tailor a solution that works in your context, for example. Such a habit to look at your watch and it's not there. But anyway, so lots of different strategies there. These are all well documented, and just some examples. So on the upside, these are my tips for closing the no-do gap. So they address those 5 reasons that implementations fail. So we need to be clear about our aim and our innovation. It needs to be really well defined. And I like to say innovation because I think some of the work that you all are doing is innovative, no matter what it is. I think intervention's kind of a bit dull, and program maybe too. But I think we're doing really great work, so I love innovation. Understanding our context, really important. Doing our homework, doing that formative research before we get started. And if we're rolling it out in different areas, we need to understand that local context as well. When we were rolling out the Indigenous version of My Health for Life, there was no uptake in the Cape and Torres area. So we had to go in and do work with them on the program, but also on the evaluation tools. What worked here in Brisbane with our local Aboriginal and Torres Strait Islander people and the language they used was completely different to what happened on Thursday Island, for example. So we need to actually go and talk to those people in their community to understand what they're doing. So that place-based approach is really important, and really understanding the different contexts. So engage people throughout the process. We've heard that for the last 2 days. Cannot emphasise that enough. Don't base things on our own assumptions, because we're only going to get in trouble. I could give you 30 examples just off the top of my head of assumptions. And when you do a logic model, it's underpinned, what are our assumptions? And what are the things that we need to actually throw out? Especially for middle-aged, white, middle-class, blonde-haired woman. If I go out into Western Queensland, I've got to throw away that identity and really sit and listen to those people. Develop a clear, logical plan for change. Again, going back to our Toowoomba example yesterday, that was just such a great example of how to do this, and then follow that plan and make changes along the way. And then build support for sustainability. Super important, because we don't want to just have our innovations left in a filing cabinet drawer. And I know there's little green ticks that I should have been clicking on here, I forgot. I shouldn't put things like that in because my brain is always racing ahead of other ideas that I want to tell you about. Okay, and that is me done. Thank you very much.
Thank you very much, Joy. That was an excellent presentation. Now, I've got a question for you, and anyone else who wants to throw a question in, if you put it into Slido, I've got my little bits here to keep reading. But Joy, what's your best advice? Because people tell us that measuring and evaluation is expensive, and they often don't want to do it because of the expense. So what would you say in comment to that?
I would say, what is the number one thing that you are trying to achieve? So what is your key objective of your program, and find a way to measure that. If it's, we are trying to reduce blood pressure, measure that. But just keep it simple, but find what is the thing, one thing that you're hoping to see change, and measure that.
Such lovely, clear advice. We're just loading just to check that there's no more questions.
And whilst I'm here, I just want to say, as one of the sponsoring partners, I'm the Vice President of AASM, and I know I was meant to do this at the beginning of my presentation, but if it's not on my slide, it goes out of my brain. But we are really proud to be partners of such a wonderful conference, and to see all of the wonderful work that you're doing here. It's just such a great opportunity to come together and to work together. And I encourage you to go to the AASM website if you're interested in knowing what we do or becoming a member. It's a really good organisation of like-minded people, and we offer a range of webinars and other events as well as other member services. Sebastian sends out a newsletter with lots of updates, which are always really good, latest publications, jobs, what's happening around the country as well.
Joy, I love your pink suit.
Thank you.
You talked about adaptability to different contexts. How can this be tested or trialled? Because reproducibility across contexts is hard.
Yeah, well, I guess that's probably the million-dollar question, but that's something that you need to understand. So often that is a big barrier, is being able to take it from one context to another. And I guess sometimes that just comes down to funding. But I think as social marketers, we always want to tailor and target whatever it is that we're doing for those different audiences. So it's just about understanding what the needs and wants are of those different areas, and what might be preventing, or what might prevent you being able to roll that out into the different contexts that you're going into.
Do you have a compendium that summarises those many implementation frameworks that you put up?
Edison is doing a PhD with Timo, myself, and Dr. Bo Pang, is working on that at the moment. So that's part of his PhD, his first study in his PhD. So we are coming up with that. There are papers. Email me if you would like. My email address is very simple, joy.parkinson@csiro.au. You can also Google me, of course, but please reach out. I have got some papers and things that I can send you that has a whole host of those things.
All right, and there's another question. How much time do you think is needed to plan everything from preparation to implementation?
Oh, how long's a piece of string? That's a really good question. I think it depends on what your budget is. And depends on what you're doing. And I think over the last 3 years, we've learnt that we can do things far more rapidly, I don't really like saying more agile way, but, to use a buzzword, in a more agile way. But I think if you can allow at least some time to start working out who are your stakeholders, who do you need to listen to, and then start to plan. That could be, anything from a couple of weeks, depending on what you're doing, to maybe 6 months or 12 months. Really depends on what your problem is that you are trying to solve.
Okay, and with no further ado, I would like to thank Joy for coming out onto the stage today.
Thank you.
I always think being the last speaker becomes quite intimidating because it's that pressure of like, wow, I've just sort of really lived. Now, yesterday we did not have enough time to actually hear back from Alan, and there was a lot of questions around his car culture talk. There are a lot of other questions in here that relate to exactly that in terms of tips, advice, and how do we change anything. So let's be real, it probably doesn't matter which industry we're challenging in terms of, does this really make sense? And I think for me yesterday, Alan provoked my own thinking in terms of, wow, what a waste of space cars can actually be. That diagram that showed this is 200 people sitting here just doing nothing, for me was very powerful, and I felt a lot to actually start to argue from, because I have myself been thinking, why do we have a car industry here in Australia? We don't make cars anymore. And then I'm challenged by people and partners that I'm working with to say, well, let's reduce obesity. And Alan reminded us yesterday that cars are one of the biggest contributing causes to that epidemic that we're actually dealing with. So a lot of this is interconnected and interrelated, and I know a TransLink team's here and they're dealing with all sorts of travel behaviour things all of the time. And I shared my own story about how I went car-free on a sabbatical because I thought, what a great time to test this. And in New Zealand, on that short trip, I actually learned that you make more friends because you actually ride share and just bum a lift and get around, and that you actually start to connect more in a way that you're not going to do sitting in your own car by yourself. And by San Diego, when I did the next months of no car over there, well, I actually learned cities and people and places and spaces, and I was having a great time. So much so that I wanted to come back to Brisbane and not have a car. That lasted for a week because I looked up timetables, and if you look out there today, like, it's a pretty light rain today, but if Brisbane gives you its best, you are talking drown rat and maybe wet t-shirt competitions, which in the line of work I do is probably a little bit uncool. So I kind of figured out that maybe walking and biking isn't going to work for me every day when I have to be out and doing my public-facing kind of stuff. And why did that dream die? Because it takes me 1 hour through different bus connections to get from my house to the university. And anyone who knows where I live, I can drive it in under 8 minutes. So that's just crazy, isn't it? So here was me wanting to actually flip away from making a statement, right, I'm going to have no car. Couldn't happen. So Al, come on down, join me. And I'm just going to flick some of your questions out for Al for a very short discussion at the start of our open mic session. And then anyone who wants to come to the stage, I will give you your turn next. So if you're ready to share a problem and brave enough to come up, just warm yourself up, because today we're just getting Alan under the bus. Okay. Al, there are same problems with the big food. How can the public health counter lobbying, marketing and influence of industry with government?
Got off to a bad start there. I'd missed the first bit of that. Sorry, Sharyn.
You're all right. So it did start, I'll give you a compliment. Al loves compliments. Thanks for a great presentation yesterday.
Thank you.
So big food is a problem, just like cars. Plastics, we've spoken about this morning. How can public health counter lobbying, marketing and influence of industry with government?
Good question. By the way, this is Dress Down Friday, and Australia, I have to say, I'm very disappointed with you. I thought you'd embrace this sort of relaxed code of dress today. Actually, I'm feeling a bit embarrassed with my shorts and t-shirt. But I did walk over, I'm practicing what I preach. Do you know what I mean? So I walked over Goodwill Bridge in the rain, as Sharyn has just pointed out, which is why I'm looking a bit bedraggled. Anyway, Gerard Hastings talks about this a lot. There are some very, very good, some really good papers in British Medical Journal, The Lancet, that respond to this business of whether it's big food, big alcohol, big tobacco. Big tobacco created the propaganda playbook that the other big industries have followed, of how to respond, how, as a commercial company or a commercial sector, how to push back against reform and change when it knocks your profitability, even though in the case of big tobacco, if you kill half of your customers, which is why you have to work so hard at replacing your customers, because you're killing them off at such a rate. Big car is not in quite the same league as big tobacco, but it's the same propaganda playbook. So the first thing to do is understand what the playbook is, and they start by pushing back against the science. So they say, big tobacco, oh, smoking doesn't cause lung cancer. Then they move on to arguments about, oh, what's it got to do with you, government? This is individual choice. So they always push the freedom argument. That's the second argument. And then they will move on to kind of other things like, in the case of big tobacco, you can't possibly reduce tobacco, push back against what the company does or what companies do, because it will affect the economy. So they do science, liberty, economy. That's the playbook. And that's what's going to happen with big car if and when, I mean, by the way, they're winning. You know, public health is barely a scratch on the side of the wing mirror. Do you know what I mean? Public health is not in the game here at all yet, and might not be. And that goes back to what I talked about yesterday, which is how deep is our love. You know, we love our cars a bit too much, and it's a tough business trying to wean ourselves off it. So where the public health come into this? Stop it, please, please. We're just too cute at the moment. Gerard describes us as we're like cute little hedgehogs snuffling around. We're nice. We're really nice people. And big car is not, you know, when push comes to shove, they're not nice. Big tobacco, you can read all that for yourselves. You can see what they did. They play dirty. So yeah, there you go. A few things to think about. First thing is expose the playbook, and then go from there. Lobby, get a government in that is receptive to this. I'm accepting your commiserations for what is going on in my own country at the moment, governmentally. We've had an interesting, a little while now. Yesterday was particularly interesting. And if the further we can move away from governments like that, so Liz Truss, who's gone, is a libertarian and is the opposite of what I'm trying to argue for public health interventions. And Therese Coffey, who's our health secretary, and I hope she goes, I presume she will, on the back of this, Therese Coffey is a libertarian, and so has accepted hospitality from big tobacco, and she's our health secretary. So if you think you're feeling some pain here in Australia, come over to Northern Europe sometime, and it's a different game at the moment. Long-winded, sorry, Sharyn.
You're right, Al. I've got another one for you.
I'll be shorter with these.
What is your take on positive versus negative measures to discourage car use?
You've got to go. Unfortunately, you've got to disadvantage the car. So the evidence from around the world on this is really quite clear. It would be lovely to say positive kind of incentives, incentivizing active travel, incentivizing me to walk over the bridge rather than get a taxi round because it's raining, tends to work. Well, it can work, and it's worked with me, but here I am in a pair of shorts and a scruffy T-shirt in front of you. And Sharyn's point is well made about the realities of life and so on. You have to, in order to change behaviour with car use, you have to, in the trade, it's called disadvantaging the car. So how do you do that? You introduce things like filtered permeability, which is a bit of jargon, and what that means is, in Amsterdam, in Copenhagen, they block roads. So they have one-way roads. They filter it so that they allow cyclists and walkers to go through. They might allow buses to go through, but they block roads for private car use. If you want to drive into the middle of Amsterdam or Copenhagen, it will take you ages, and you will have to pay a congestion charge, perhaps. So these things are disadvantaging car use. So you have to penalise car use. Why? Because how deep is our love? Cars are wonderful, wonderful things for selfish, personal, problem-solving travel. They're wonderful things. I've got one. They're great. So we have to be we have to be acted against ourselves. That's how that works.
So this is a comment that's come in while you were chatting. I've learned here how to deal with my husband's tobacco addiction, car addiction. Nice. People don't want change. How do we make changes easier?
I think I've kind of answered that with the previous question. I think, Sharyn, people don't want change with cars. What they want is all the other car users to sort of buzz off and leave the streets nice and clear for us, right? Huh? And it's just not happening. It's like, oh, I'm stuck in traffic, to which the answer is, you are traffic. So I can't find myself doing this. Oh, shit. I ring my wife or whatever, I pull over, I try and be legal with the phone, or I use hands-free. Oh, I'm stuck in traffic. No, I am traffic. And that's a profound insight into your own selfishness as being part of the problem. So, yeah, we have to be actively disincentivized. That's the evidence from around the world. Positive incentives to walk and cycle, they might shift the dial a little bit, they'll shift the dial a bit, but they won't introduce cultural change.
That is wonderful. Can I ask the room to thank Alan for coming back across the bridge? Walking in the rain, like, poor Al. That was a big ask, wasn't it? Can I ask Phill Sherring to come down? He's just sitting at the back of the room. Phill is running a workshop this afternoon, and because we had so much blatant promotion of other workshops, I felt it only fair that Phill actually have a moment to talk about what his workshop's doing. David, you'd be very welcome to do the same, because people are just in and out and shifting a little.
Is this on? Yep. This is my last-ditch attempt to get you to come along this afternoon. Can I have a show of hands? Who here has heard of a pea weevil? P-E-A, like the vegetable. Anyone? Nope. Okay. That was my reaction about 6 years ago when my boss came over and said, Phill, we have pea weevils in the Wairarapa. And my first thought was, shit. My second thought was, what's a pea weevil? And then I knew what was coming, because this comes in my job. You need a campaign out about them in a day. And that's generally one of the things that sticks in my job, is when, especially nasties from Australia like Queensland fruit flies get in, or other biosecurity threats, they get into the country, and I get a day or two if I'm lucky, to get a campaign out the door. And that's kind of what I'm going to talk through the workshop this afternoon, is when the proverbial hits the fan and you've got to get something out and market, what's the tips and tricks to do it? And then down the line, how do you then start to bring in some of that social marketing stuff that we all know and love? Because when you first got to get something out, you can't plan, you can't research, etc. But then how do you start to weave those in? So that's my last-ditch attempt to get you to come along this afternoon. Hopefully it's worked, and I'll see you then.
After all, Phill has come all the way over the ditch just to be able to speak with us today. David, would you like to briefly talk about what you're up to?
So probably about 5 years ago, we took a proposition to the federal government that they weren't very effective in their communication, and we'd developed a strategic communication and engagement planning framework. But what we didn't have was the evidence base that sat underneath that particular framework that we developed. So we put the proposition to the government as part of the National Innovation Science Agenda to get the research funding to be able to do it. So we went to the project management academics at the ANU and worked with them over a couple of years to build basically pretty much a logic framework as to how do you build a communication and engagement. Follow the bouncing ball. These are the questions that you need to follow and you ask yourself. It's sort of probably a close first cousin to a lot of the work that we've been talking about today. So it's really more how do you work from a lot of the insights, a lot of the research, a lot of the data, and then how do you turn that into stories that you can then communicate out into to the various stakeholder groups that you've engaged. So it's a sort of evidence-based framework. We're going to, I hate to say this, but we've printed off sort of A3s that you'll be able to take away as a gift. And it's something that you can, it's pretty straightforward. It's not massively complex. I come to this space from a journalist background. I used to be a political correspondent in the Press Gallery in Canberra. So I'm really more of a journalistic, coming at it from that storytelling point of view. But it really, one of the things that really has struck me over the last couple of days is just how close and how important that it is to bring these two, social marketing and journalism type skills into our storytelling, so as that we can impact those audiences to achieve the change. So, at the 2 workshops today, great to see you there, and we'll have a bit of fun along the way. So that's what I'm doing this afternoon. Thank you.
And I think if it isn't hard enough for speakers who come up here and do it once, I do want to put a very special thank you out to the workshop facilitators who are going into repeat mode this afternoon. So you can guarantee by the second version of whichever one you decide to go to that they'll already be that little bit smoother, and they'll just be like nailing it. So I too am looking forward to just sneaking in and out. I sometimes wish maybe we had all of them running in different time frames for all of us. So thanks again for being willing to do that for us this afternoon. Now, a final one is, would anyone like to actually take the stage and share the mic? This is my moment to put it out there and say the floor is yours if you would like it. And Yue has her hand up in 5 seconds flat, ready to go. Yue, please come on down. A big thank you, by the way, yesterday when she actually actively sought to get some research from all of you.
Hello. Hello, everyone. How are we today? I'm the e-waste girl from yesterday. Actually, I got a new nickname, the Combi Girl. I love it. Thank you very much. And I have 2 things I want to deliver today. First is thank you very much for all your listening and your feedback from yesterday, the open survey. Thank you very much. We collect all the impressive data here. And guess what? According to the data, all the information there sitting in the Combi theoretical framework. That means I chose the right framework, right, Joy? And I'm hoping it will keep working on my following studies. So based on the survey yesterday, and I have 2 more new questions for you all. First is, can you identify the difference between electronic and electric devices? Because the e-waste stands for electric and electronic devices. So can you identify the difference? Please scan the QR code and post your answers. And the second question is, because we're using Combi theoretical framework, capability, opportunity, and motivation behavior. And we all know another word is ability, stands for motivation, ability, and opportunity framework, MOA framework. Can you identify what's the difference between ability and capability? Thank you very much for posting your answers, and thank you very much for supporting us here. And a big thank you for the media team back there, social marketing team, my supervisors, and my friends back there. Thank you very much.
That happens every single day at work. There is so much enthusiasm, but forever ago I did send out a post just to thank Yue for the coffee that appeared on my desk every day, feeling terribly guilty that this poor student was giving her professor a coffee. And then I learned out the coffees were free and she actually doesn't drink coffee. I felt a little bit less guilty after that. Now, if there's no one else that actually wants to run downstairs, down here, and stand in front of everybody and embarrass themselves shamelessly like I've had to do for the last day and a half, I'm just going to move a little bit forward into some of the winding up and wrapping up. So if you've enjoyed or loved a bit of the time that you've spent here and want to learn a little bit more about marketing or the approaches, how do we do co-design, we actually are, from next year, running both a summer and winter school. This will become a standard fixed thing that the team will actually actually be running. We are big, passionate believers about trying to teach others how we go about what we do. Anyone who works with us understands the scope of work and how it's all partners and we all need each other to make some of these really big bits of change happen. And in my own DNA, it has been a very big part of what and how I've actually structured it. It is why I sit in a university. We are here to share our practice. We learn every day, and every time we start to get closer and closer to the new advancement and the thing that we found, we start shouting it out and sharing it with you. So if you or colleagues and other people that you think might be more interested in learning a little bit more about how to do more of this, please do a bit of shouting out for us. We would greatly appreciate that. And next, my slides are not moving. It's been running beautifully. See, being down the front, it's awesome, always great. Lots and lots of things going on. And then I went too fast. All right. One of the things I would actually ask of all of you is to actually go forward and actually give us your feedback. This is not a long survey, so be very open, very frank. We did have a hell of a lot of background operational things going on this year. We know we weren't perfect. So we'll take every bit of feedback. We're marketers, just tell us, and take it all forward as we continue to plan. So Change 2023 will be back. It is always held at the end of October. It's kind of getting close to the end of our year, and it's kind of our way of starting to wrap up. The team tell me we might just bump it out by 1 week or two to make it a bit easier for our student volunteers. So give us your feedback, tell us what you actually think. We're listening. If you don't get it today, it'll probably be on an email to follow up, so you don't necessarily just have to sit and gather that right now as you do it. Now, I believe I've got somewhere around the room Sandra and Christina who are going to help bring in the volunteers. We would just like to thank them for the hard work they've been doing in the background. Like our speakers, they gave us their time, their energy, and that saves us all in terms of not having higher conference fees. So I can't thank everybody enough, from both speakers, workshop deliverers, the people helping us to actually make this happen, because you do help us just keep it real. So it's been amazing. And so for all of us, I think we need to reflect that there are hours. This team have been getting here every day at 6 a.m. to just make it a beautiful, seamless experience for the rest of us, as have some of the members of our social marketing at Griffith team. So do give the people who are usually wearing red, some of you may have accidentally got a red one too, do give them a bit of an extra thanks, because they've just been trying to make it as easy as we actually all can. So volunteers, come on down. This is our photo opportunity. You have to come out. Out you get. All right. So my first volunteer, who has sat close and next to me the entire time to keep us all in track and on time, is Kim. And we've all heard about the fabulous research to come. Edison? Probably likely to be standing up on stage at some later point. And to Crystal for all of her energy. Maybe not here today is Jay Naidu, standing at the back hiding, or doesn't count himself as a volunteer. Stand up, Jay. I possibly will actually mispronounce the two T's, who came all the way from the Gold Coast to actually help out as well. So I'm not going to actually butcher their names, I'm just going to bring you both forward. All right, and once again, just a big shout out to the back end team like Mel, Christina, Sandra. I really can't thank you all enough for how you just look at me sometimes with a face that tells me I'm as stressed as hell, which Marty was also showing yesterday, but have just generally really hardly complained and just got on with it. So I can't thank you enough. It has been absolutely amazing. So I get to clock off. That's it. I am done. So you are going to lunch. Anyone who has actually registered for a workshop, we will actually, as a group of volunteers and myself, walk you across to the next building at the start of the first workshop sessions, and we will get you settled in. But You have also got your map, so if you want to go off and you want to go wandering and disappear from us, the building that the workshops are in are behind the ship inn. So there are a series of rooms all booked there, and this is why we had to do the space management demand thing. So if you've still changed your minds and you're playing a bit of a swapping game, and you get told by the team there's not enough, that's because there's not enough seats. So just smile at them, be nice, be gracious. If there's so much demand, we'll just ask or strong arm them into coming back again next year, so you won't miss out permanently. But again, from me, a big thank you, and I'll be around all afternoon, so I'll enjoy just kicking back with you.